Save Child Stop Abuse for Every Child was founded in 1992 by the Junior League of Raleigh as a community response to gaps in child abuse prevention and support services in Wake County. In its early years, the Junior League provided funding, leadership, and volunteer support. Its origin mission was to eliminate child abuse in Wake County by supporting families, educating parents, and delivering prevention and intervention services. The organization was conceived because the Junior League's research identified a lack of local services specifically oriented to child abuse prevention and direct family support. The evolution of Save Child has began as a community founded nonprofit that was focused on prevention and direct family support. Over time, it has grown in scale, added intervention, advocacy capacity, constructed a purpose built facility, and broadened its pragmatic portfolio. In 2009, Safe Child established an advocacy center to provide coordinated investigation, evaluations, and support for children suspected of abuse. In 2024, Safe Child completed a capital campaign and moved into a new 20,000 square foot facility, which consolidated its services under one roof, allowing an increased capacity for services. The industry for Safe Child operates in the nonprofit, social services, child welfare, and child advocacy sector. They are a child abuse prevention and intervention agency incorporating parenting education, advocacy, and therapeutic support. Safe Child is indeed a market leader in its domain within Wake County. Safe Child is the only organization in Wake County offering a full range of child abuse prevention and intervention services directly to families at no cost to them. Child abuse prevention is a niche and it's a mission driven area. Safe Child's competition is less about market share and more about service gaps, funding, competition, and partnership networks. Because Safe Child is a nonprofit serving families and children, reviews are not as plentiful compared to what a commercial business would have. But from their own site, the media stories I was able to view, and some community feedback, a number of participant voices are shared below. A participant said that the parenting classes gave him knowledge, language to name needs, and tools to understand his children better. An attorney at Law Magazine, a case story was recounted and a child was referred to Safe Child after a traumatic incident, which framed Safe Child as a turning point. You're going to be okay is a phrase used to signal hope and recovery. Another parent that utilized Safe Child services stated that I am still using so many of the tools that you taught me. We are making the best of it. We are both safe and healthy. I did not find formal complaints, but did discover several Safe Child participants voicing concerns around their wait times for appointments, accessibility, and capacity constraints. Safe Child could address those challenges by having better time management when scheduling appointments, perhaps expanding their office hours, and doing in-home resources due to accessibility complaints. Safe Child offers a range of services from parenting, education, and support programs, advocacy, intervention, and forensic services, school-based prevention and awareness, multilingual, culturally responsive services. I do want to emphasize their forensic services as Safe Child now allows for trauma stories for children who have been abused to be told once so they are not re-traumatizing the children. They collect that information and then they share it to the necessary parties to minimize trauma to the child. Social responsibility for Safe Child is them offering their services free of charge. All Safe Child services are offered at no cost to all families. They have volunteer engagement as they rely heavily on volunteers. The Junior League, for instance, has contributed thousands of volunteer hours. 15,000 hours in the early years were donated for mentoring new mothers, training children, and caring for children during program sessions. They also have advocacy and awareness in regards to public education efforts, community outreach, and partnership with other organizations, help raising awareness about child abuse and its prevention. Safe Child's community impact can be found in their collaborative roles and donor partnership and grants. Safe Child raises funds through corporate, foundation, and governmental grants to sustain and expand their services. The capital campaign for their new building raised over $11 million from deep community support, and it also included support from Wake County, the City of Raleigh, and WakeMed Health Hospitals. By coordinating multidisciplinary responses, they help reduce duplication, reduce trauma to child victims, and strengthen system-level responses to abuse. Thank you for taking time out of your day to learn more about Safe Child.